Hello to all the HubLE audience. My name is Tsuyoshi Isojima. I'm a pediatric endocrinologist and the head at Department of Pediatrics, Toranomon Hospital, Tokyo, Japan. Today, I'm here on behalf of HubLE for edition of HubLE publication with Dr. Olawale Alimi. We will be talking about their work the paper titled Histopathological and Radiographical Evaluation of capillary demineralized bone matrix in a critical ulnar defect in a rabbit model, which was published in the Journal of Orthopedic Surgery and Research. Hi, Olawale.
Yeah, hello, Dr. Isojima. It's nice meeting you, and thank you for having me here.
Nice to meet you. First of all, could you introduce yourself to the HubLE audience?
Yeah, thank you. Olawale Alimi is my name. I'm a doctor of veterinary medicine from Nigeria, and I lecture veterinary surgery with specialization in veterinary orthopedics at University of Nigeria at the Department of Veterinary Surgery and Radiology, and I offer clinical service to Veterinary Teaching Hospital, University of Ilorin.
Mm-hmm. Okay, that's great. And so to start with, could you tell us a summary of your work and how it fits into the big picture of your field?
Thank you. Our goal is to find solution to problem of bone deficits following fracture in the clinic. Of course, because we're from a developing country and most people are living below poverty line, so we cannot afford buying the commercial bone graft most of the time. So we're looking into possibility of finding something to use, and that's why we're trying to look into the use of graft in the clinic. And in this study, we used capillary demineralized bone matrix in a fracture defects in a rabbit model. Mm. We use capillary because the capillary that's good fits into a better animal species that can be used as a donor, better than cow or bovine that has been worked on extensively as a donor, because goats, as we know, is a small ruminant that can easily be handled, reproduce easily, and they have shorter duration of pregnancy, shorter gestation period. So if we want to keep animal for the purpose of bone graft collection, goat will fit better than a cow that is costly to manage. So in this work, we harvested bone from the goats and we demineralize it. It has been studied that demineralization of bone frees proteins that enhances bone repair, bone regeneration. And our target in this study, even though we don't have the facility to conduct all those studies, our target is bone morphogenic proteins that is known to enhance bone healing. So following demineralization, we took the radiograph to monitor or to evaluate how the success of demineralization. Of course, we know that a normal bone will be denser on radiograph as compared to demineralized bones. So that's what we had to use, and we checked that. Following that, we use a rabbit model for the study. We use a rabbit model as well because we want to do an interplay between targeting human population and animal population. So we find rabbit to be more in between, to mimic dogs or human that we are targeting, rather than using just rats or mouse model. So we conducted demineralization, and we created critical ulnar bone defects. We use these we use ulnar because there are two bones in the forearm, ulnar and radius. So we want the radius to balance the defect that we are creating, so that there will not be a problem with the locomotion. So we don't want to cause so much harm to the animals we're using. So that was why we use ulnar, and it also allows us to, I mean, have more stability at the fracture site. That's at our site of evaluation. So after the implantation, of course, the surgery, was needed here. So we monitor the healing over a period of 8 weeks. We took a radiograph every 2 weeks, and after of course, that's what we do in the clinic. We monitor the healing every 2 weeks, and we did that for 8 weeks for the purpose of this study. And after 8 weeks, of course, there was progressive bone healing. We observed that from 4th week, there has been there is progressive bone healing until 8 weeks, and after that, we sacrificed the rabbits and we collected the tissue for histopathology. Unfortunately, that was anything we have access to. We don't have researches to do, MRI to do, even IF. We cannot do fluorescent techniques to check all the bone morphogenic proteins that we target, or other proteins like that. So we could only use histopathology and radiograph. So when we analyze the radiograph, compare with the positive control, that was the autographs, because that's the standard. We use autograph as the positive control, and we use an unfilled defect. We created the defect without any implantation. So we compared our test group with positive control and negative control, and we could observe that after 8 weeks, our test was comparable to the positive control. That's the autograph. That there was no statistical significant difference, but there was significant difference between the negative group and the test. So this histopathology also showed similar results. There has been osteocyte migration into the site of the defect, and we observe some osteoclasts, which means that there has been creeping substitution. The innate cells have been migrating into the capillary demineralized bone matrix to see, and that was why we saw the bone healing as we observed in radiograph. So basically, that's what we carried out.
That's interesting, and I think the result will be a promise not only for the animal fracture but also the human fracture. And also I'd like to know what is the most important thing you learned in the study?
Well, it has been my goal to become, in the clinic, I'm a veterinary orthopedic surgeon. So, and I also want to be not just a clinician, I want to be a researcher in the field of orthopedics. So this was my first project in the field of orthopedic research. So from the beginning, the design of experiments in the field of orthopedic research, carrying out the study, and writing up a paper like this in orthopedic research. So those are things I learned. And for the research, that was my first hands-on surgery in the creation of fracture model. So that was my first time I created a fracture model. So radiograph I did the radiograph, did histopathology. So all these skills that are useful in the field of research in general, this project exposed me to them.
Yeah, that's great. You had a good experience. Yes, and
Thank you.
what was the greatest challenges you encountered with this work, and how did you overcome them?
Yeah, thank you. The greatest challenge was that I had wished to, I wanted to monitor, I wanted to evaluate the immune response to a xenograft. Of course, we expect that there will be immune response. So, but we don't have, the problem is just that we don't have fund, we don't have equipment to carry all this. But what we have, we manage what we have. That was the use of from simple physiology. We know that when there is a foreign body to the body, there's possibility of eosinophilia in the blood system. So we could just manage to use a blood picture to monitor response to the bone xenografts, even though it was not as good as we want, but we use it as we could afford.
Yeah, that's a good experience, and you had big efforts to overcome them. And the next, is there any limitations in your study? And
Oh,
how will you overcome the limitation for the future work?
there are several limitations. The first is that we could have first done some biocompatibility tests before even going to the in vivo study. Could have just take the demineralized bone matrix and implant it in subcutaneous layer of course, rats or mice. But because of the limitation of fund we have, because it's good to let the world know that most researchers in Nigeria use their salary to fund their research. So we could not do that. So we went into the in vivo study straight. So that's a big limitation. And during the process of the review of this paper, I had that challenge, and I had to explain way that we could not afford to carry that out. Also, in the current world of understanding the mechanism of the functionality we are seeing, we cannot prove to the world that how did our bone demineralized bone, how did our bone demineralized bone matrix, how did it get incorporated, and what was the crosstalk between the matrix and the cells of the and innate cells. We could not explain that. So even though we are sure that the bone the matrix is having high level of bone morphogenetic protein that will enhance the fracture healing or recruit cells around, like osteoinduction, that osteoinduct the cells around. We should have done histoimmunochemistry to show that this protein is actually expressed in the graft before before implanting it, and even after implantation, at least after the 8 weeks of the implantation. So now I know what I should have done. I know how it goes. That will take into cognizance in the future experiment. Also, ultrastructure level of these bones are very important. That's when we want to be able to talk about the ultrastructures of the matrix we implanted, the rabbit bone itself,
Mm-hmm.
and the result after the healing. So we should be able to do studies like use equipment like MRI to, or CT scan,
Mm-hmm.
micro CT, to be able to show that. But we could not do all those because of the funding limitations we have. But they are noted. We know them,
Yeah.
but we cannot afford to do them.
Yeah, I see. Oh, I see. And okay, so you've already talked the reviewer's comment, and it may be your first experience to publish the journal. So, what was the experience publishing in the Journal of Orthopedic Surgery and Research? Was it good for you? Good experience? And it was hard.
It's
Was it hard?
it's a mixed feeling. It's a mixed feeling. Well, I understand understand the fact that I'm a young investigator, and the reviewers are learned. So I see it as a learning process. So as they are raising the comments, I'm trying to learn more and give a response. However, what I will appreciate with this journal or the BMC Springer in general was that they offered us they waive the article processing charges for us, because we explained to them that we cannot afford to make the payments. We cannot afford to pay the university is not paying for us, so they waived the article processing charge for us, and that I must commend BMC Springer from. Yeah.
Oh, okay, I see. And also, okay, so in terms of your career and the future goals, how will this publication help you to achieve those aims?
Yeah, thank you. As a young investigator, the next is that I want to move forward. This I must be sincere that this work had really helped me in getting my current PhD position, because after this study, I tried to network with bone researchers over the world to find PhD positions with them, and with this work, with the understanding and the experience I had from this work, I've gotten a PhD position, and I'm currently working on muscle atrophy following denervation. So, and that's another area in musculoskeletal research. So, the paper had really helped in achieving my career goal as a successful musculoskeletal researcher.
Oh, that's great. And okay, so thank you for taking the time to discuss your work today, and we hope to hear more from your group in the future. And
thank you so much. It's nice
okay,
talking
and
to you.
we would like to thank the audience for taking the time to join us today. And if you would like to share your work at HubLE, please feel free to contact us.